Joining us live tonight from Omaha, Nebraska, University of Nebraska Medical Center Chancellor Dr. Jeffrey Gold. And live in Middleburg, Pennsylvania, Congressman Fred Keller from Pennsylvania and Middleburg there. Thank you so much for being with us tonight. A very important show. Dr. Gold, let's start with you. Let's get an overview, first of all, of how widespread COVID-19 is in rural America right now.
Thanks, Tammy, and thanks to everybody for joining us on Rural Health Matters tonight. So the numbers, of course, in the United States just continue to rise. And as our first graphic will show you, we're almost at 4.7 million confirmed cases across the United States and just over 155,000 confirmed deaths. And as we've said repetitively, there's been a continuous shift from not only our large cities across the great southern states of South Carolina and Florida, Louisiana, Texas, Arkansas, into California, but into the central part of the United States. And we've been seeing upticks in Kansas, in Iowa, here in Nebraska as well, although not quite as substantial as we've seen in other parts of the country. The numbers in both the rural and urban communities, and now even some of the smaller farming and ranching communities, continues to rise a good deal as well. If you look at the trends over the last months of this pandemic, and I think our next graphic will give us a good idea about that, what it shows is that we peaked out in late April, early May, with not only our 7-day rolling average, but the total number of new cases reported per day in the United States, and then fell until mid-June, early July. And so just about the time of just before the 4th of July weekend, we started to see a bit of an uptick across the United States, and the last several weeks have brought us to as high as just over 70,000 confirmed new cases per day. Fortunately, over the last several days, the information has been somewhat better. We're down from the 70,000s to the 60,000s, and is down as low as, I believe, yesterday, 48,000 cases per day. Now, tragically, these not only convert into hospitalizations, but as the next graphic will show us, they also convert into deaths. And what we can see here is that we had a large peak, particularly when New York City and the tri-state metropolitan area on the East Coast were peaking in late April and early May. We saw a significant fall off in the number of deaths per day, confirmed deaths from COVID per day, through June into early July. And that reflected, first of all, better understanding of the treatment of the virus, keeping people out of the hospitals, but also a definite shift to a younger, healthier generation of Americans. And indeed, what used to be predominantly nursing homes and long-term care facilities has been rapidly translated into social gatherings that has resulted in a really lower death rate. But as this graph shows, particularly the 7-day rolling average, which is the dark line, Tammy, that has continued to show us over the last several weeks an uptick. And that's because these young, healthy people, fortunately or unfortunately, have parents and grandparents, next-door neighbors, friends, co-workers who are older, who may be more vulnerable due to medical conditions, and that's resulted in an uptick in hospitalization, particularly in Florida and Texas and Arizona and in California. And as we look at these hotspots across the United States, you see the deep red colors where we're seeing the growth of these cases along the southern belt, deep into Texas, and of course southern and central California, Tucson, Scottsdale, Phoenix, and many other communities across the United States. We are starting to see a flattening of the curve in these areas, but unfortunately hospitalization and fatalities are lagging indicators, and so we're going to be waiting for a good number of at least 2 to 3 weeks before hopefully we can start to see a plateau. So that's the state of the art of the spread of COVID as we are today.
where we are now. Interesting to look at those numbers. Now, Dr. Gold, I've heard from Dr. Fauci at the White House that he's even now recommending that people wear goggles, not just the mask, but the goggles to keep from spreading the virus. What's your take on that?
Well, there's been a number of recent studies that have been important in that area. One is a study that shows that spread through the lining of your eyes, known as the conjunctiva, can actually transmit the virus. And so months ago, most of the healthcare systems in the United States went to an eye protection mode for our healthcare professionals, either goggles or face shields or something along those lines. But in the last several weeks, there's been a good deal of literature, some of which related to the World Health Organization position, and some of it actually related to research done in our own institution by Dr. Santarpia and Dr. Lowe, showing that you can recover live virus from the air. Now, we don't know for sure that the infectious load is high enough. So, for instance, we do know, like with measles, that measles is transmitted through airborne spread, so-called aerosolized spread, and that it can cause infection with a very, very small number of live virus particles. We don't know that for sure with COVID, but I'm guessing that what Dr. Fauci is thinking is we want to at least create that awareness. So it all comes down to the appropriate social, or what I like to call physical distancing. And of course, what I mean by that is maintaining the 6-foot distancing among and between individuals, particularly when we're in closed spaces, particularly when we're caring for somebody that we know may be sick or we suspect is likely sick with COVID. We want to protect ourselves from those tiny little droplets. We want to protect our nose and our mouth and, of course, our hands through hand sanitizers. But we also now want to protect our eyes. And that's why either wearing glasses or some other type of eye protection is probably in our best interest under those circumstances.
All right, that makes sense. Now, Dr. Fauci has also called out several states recently because of their current responses to the coronavirus. What would you both say to that and to state and city leaders who maybe are not following the recommendations and they're actually leaving things open? Dr. Gold, we'll start with you again.
Well, again, I'm not so sure this is a matter of rules and regulations as much as it is a matter of personal responsibility for ourselves and for each other. You know, we have spoken not only on this show, but on every evening newscast, every print media across our nation and probably around the world of what the simple protective measures are in terms of hand sanitizer, surface cleansing, social distancing, the 6-foot rule we just discussed, facial protection, etc. And so to the extent that, quote, mandates help, you know, I'm all for them. But at the end of the day, this is about each other taking responsibility for the communities that we care about, for our own loved ones. And, you know, as I like to say, I wear a mask to protect myself and to protect others. Some who I know are ill or elderly, who are at high risk, but many of whom are not. You know, we all are aware of the recent story of a choir practice in one of our southern states where one individual turned out to be ill, of course not knowing it, and almost the entire choir ended up getting infected, several of whom ended up hospitalized with COVID-19. And so we have a moral and ethical responsibility to take care of our communities. And frankly, if, you know, back to school, and I'm sure we're going to talk about that in a few minutes, is something we want to do. We want to go back to athletic events. We want to go to church. We want to reopen in a meaningful and sustainable way at a time before we actually have a deployed, effective, and safe vaccine. That's the only way we're going to get there. And so anything we can do is going to be helpful.
Right, still up to the individuals. Congressman Keller, would you like to weigh in on this?
Yeah, I would say the same thing. We need to make sure that, yeah, I'd say the same thing. We need to take a look at who we're around and, you know, do the appropriate guidance from CDC, from the Department of Health, making sure that we're taking care of ourselves and our family and friends, and particularly those who are most vulnerable to having really severe problems with the disease. So I know that the attending physician in the House, we have the guidelines for our office, and we do the social distancing and the masks, and hand sanitizer. And I would just say that as a community, we need to take a look at that and take the appropriate precautions to make sure we keep ourselves and our family and our friends safe, and we continue to flatten the curve and come through this.
Absolutely. You know, I liken it to, we had to get used to wearing seat belts, right? And now it's just part of the habit
Right,
when you
exactly.
get in the car. Well, now putting that mask on has become part of my natural routine now of getting dressed and leaving the house at, you know, whatever time of day.
So I won't leave home without it. You know,
there you go. Yes, and so we've all gotten so creative now.
The Med Center.
You can show your school spirit. You can show your hobbies.
There you go. You know, Tammy, I think there's one other feature about masks, and like, you know, let's take Arizona, for instance. They're recently reporting 20 to 24%, I believe, positive test rate. That is very different than a community that's reporting under 1% or a 1% positive test rate for their community. And therefore, there may need to be different rules in those communities and different expectations on behaviors. You know, with good data, good testing, we can continue to monitor this. But certainly in a community that's seeing a huge amount of transmission, particularly for what we call community spread, meaning we can't trace the source of the infection, that's where the social distancing and mask wearing is going to be absolutely critical. And whatever it takes, we need to do it.
Absolutely. Dr. Gold, a little earlier you showed us the graphic and we talked about the shift in cases to rural America. Can we expound on that a little bit?
Sure. You know, early on when the pandemic first hit, it hit cities that were large transportation hubs. You know, think about airports that had a lot of international flights. And as you see in this graphic in the pink, it shows you what's happened since the very beginning of the pandemic in the large urban cities with the first major outbreaks. But over time, the rest of the country has more than caught up and actually exceeded that. And that's because of travel in the cities, from the coastal cities into the inner parts of our country. And as the cities, just like where I'm talking to you from, Omaha, Nebraska, you know, there's a lot of business exchange and cultural exchange and family travel to our rural farming and ranching communities. And all it takes is, you know, one or two small cases in one of those communities, in a long-term care facility, in a meat packing plant, in a school, in a church, and before you know it, it's like striking a match in a tinderbox, and there's an outbreak that needs to be monitored and cared for, and the numbers just continue to explode. So there was a long time that most people living in rural America, didn't know anybody who was infected, never had a friend or a relative that was hospitalized, and, fortunately, never knew of anybody who lost their life. But I was recently on a Zoom call with 15 physicians who lost their lives at just one large hospital system on the East Coast, an institution that I know well. And these are people, to a large extent, who I've known and even worked with at one time in my life. And so it gets very personal when you see that type of loss.
Absolutely, has certainly gotten personal. Let's talk about rural hospitals, right at the crux of what we deal with in rural America, because there's already limited access, limited hospitals in rural America, and they are struggling right now trying to keep their doors open. According to the National Rural Health Association, in the last 10 years, 124 rural hospitals have closed, 453 at the risk of closing. Dr. Gold, what do they need to stay operating?
Well, they need the support of the entire healthcare system. All of the hospitals in the United States, at least all the ones that I'm aware of in the region that I serve, but I also have the honor of working closely with the American Hospital Association and many, many others, that care for both small, medium-sized, and large academic medical centers, have seen a very significant and appropriate fall-off in what I would not just call elective procedures, but routine hospital business. Let's face it, I wouldn't call getting your hip replaced or your cataract treated or having follow-up mammogram or an endoscopy or a cardiac stress test elective procedure. These are all things that are done in a way to keep people healthy, and all of that has been pushed back. Emergency room visits are down, immunizations, well baby care, all of those things have really been pushed out, and that has had a dramatic effect on our hospitals and our hospital employees. Many have actually had to lay off or furlough some of those individuals, and those economic consequences are just like they are in the retail business and just like they are in many of the other service businesses, have significant financial implications, including bankruptcy and loss of viability of some of our rural and urban hospital systems. And tragically, many of our rural hospitals have really lived right on the brink of financial viability for a long time, and that has a lot to do with their location, the shrinking population in many of our rural communities, and indeed many of these rural hospitals have been the largest employer and therefore a very important factor in the economic sustainability of these rural communities as well. So this is a double-edged sword. It's about the economy, but it's also very much about health care. And in terms of what to do, we just need to get the healthcare delivery system to reflect the critically important role, and I know the Congressman's going to talk about that in a minute, from a financial and equitable compensation way. But then we need to get business back to usual in the rural communities where the virus transmission rates are particularly low. So if there's a community that's got little or no ongoing virus transmission now, it's perfectly safe to get that mammogram or that cardiac stress test, or bring your children in for your preschool physicals that you would normally need. And we've been trying to share that message that it can be done safely and reliably, and it should be done, because the longer we defer those kinds of things, the more medical consequences there are going to be.
All right, Dr. Gold, thank you. Congressman Keller, I promise you we're going to get to you, and we're going to talk about that bill that you and your colleagues have offered up. But we need to take a quick break. We're also going to take your phone calls. And so remember, our phone lines are open. We'd love to hear from you. 877-731-6733. More Rural Health Matters with the University of Nebraska Medical Center after this.
I just wanted to let everybody know that we're still here. We're still farming and ranching. We're not going anywhere. We're not going to quit. Farmers don't know how to quit. To all you folks that have been sitting at home for the last month and a half, I know you got a lot of worries on your mind, but you never had to worry about where your next meal is going to come from. And for that, you can thank farmers and ranchers. I think it's time people realize that singers, professional athletes, actors, and politicians are not the most important people in this world. The real heroes are the doctors and the nurses that are on the front lines fighting this horrible virus, and the farmers and ranchers that, despite horrible commodity prices, get up every morning and give it 100% every day and all day to provide for this nation. We will get through this. Good luck and God bless.
RFD TV brings the ag industry news you care about.
A lot of producers really looked at the hope of being able to get this deal done.
Tailored forecasts for farmers and ranchers.
You can see the pockets of red across Texas. That has become a problem, and going forward in time, we just don't have a lot of rainfall headed that way.
Live, direct reports from the trading floor with expert market analysis.
We have Oliver Slope standing by, and he is with Blue Line Futures.
Well, the outside markets are going to be the driving factor and the focal point in this week's trade.
A focus on Washington ag policy.
RFD TV's Corinne LaRue joins us from our Washington, D.C. News Bureau.
The president did sign USMCA into law today, and that was a long time coming.
And live reports from across the nation.
See lots of fun and exciting stories, especially lots of hard work that goes into this.
Stories you'll find only on RFD TV, celebrating our 20th year as rural America's most important network.
And welcome back to Rural Health Matters. I'm Tammy Arender. Joining us once again is University of Nebraska Medical Center Chancellor Dr. Jeffrey Gold and U.S. Congressman Fred Keller of Pennsylvania. Appreciate you guys being with us. We've had someone patiently waiting on the phone. Let's go ahead and take that call. It's Bernita from North Carolina. What's your question?
Yes, I was wanting to ask, such in big cities like New York with heavy traffic, or maybe China that has a lot of motorcades and stuff, when we're at traffic at a stoplight, and like, for example, I sneeze, and then I accelerate when the light changes, the car behind me, can that air be pulled in if I'm contagious and infect them?
Interesting question. Dr. Gold, I mean, I would assume that it wouldn't be, but you're the doctor. I'll let you answer that question.
Well, you know, I was just thinking about it. It is a very good question, and I certainly, Bernita, there's no reports of that in the literature that I'm aware of, but your question is right on because of the recent interest in an aerosolized spread of this. I guess my best advice was, you know, if you're traveling with somebody who you know has COVID, or you think very likely has COVID, we should minimize travel outside of the home anyway. I mean, obviously, if you need a transport to health care or to the pharmacy or something like that, we need to do it carefully. But, you know, generally, we really want to minimize that kind of travel anyway. But no, you can leave your windows rolled down and enjoy the summer weather.
All right, great answer. Thank you for that call, Bernita. Now, Congressman Keller, you have introduced a new bill called the Reviewing Urban and Rural Adjustments to Level Hospital Expenses and Lopsided Payments Act of 2020, or the shortened title, Rural Help Act. Tell us what that's all about.
You know, we did a lot of visits to the hospitals in rural Pennsylvania, in north central, northeastern Pennsylvania. And what we experienced is we do have a aging population, and the Medicare payments to rural hospitals, there's a disparity between that and urban, and for some of the same procedures, and the costing for those, you know, and what it costs to deliver health care to people might be a little different in rural Pennsylvania than it is in the urban parts. And, you know, when we talk about making sure that we have accessible care and affordable care to Americans all across our nation, we need to make sure that when people are going to the hospital, you know, that our hospital is going to get compensated equitably for providing that care, whether it's in rural Pennsylvania, you know, in Williamsport, or in Tioga County or Susquehanna County, versus, you know, somebody goes to get a similar procedure or have a similar stay in the hospital in Philadelphia or Pittsburgh. So really, this directs the HHS to take a look at this, or the CMS to look at this, and let's look at the adjustments that need to be done, because you got Medicare Severity Diagnosis Related Group, which is MSDRG, and we're taking a look at that and saying, you know, this group that requires care, let's make sure that our hospitals get compensated equitably. And that's really what we're trying to do, so that people don't have to travel hours from rural America to more urban areas to get the care they need and deserve.
Right. Now, Congressman Keller, you did that, I believe, on July 9th. Well, already just today, moments before we went on the air, President Trump issued an executive order talking about rural America. It says the White House is launching an innovative payment model to enable rural health care transformation, and that is part of an executive order that came out today from the White House, and it appears that that is going to help level out, as you just mentioned, some of the payment, make sure there's no disparity. And it also talks about increasing investments in the physical and communications infrastructure. And so both of you are well aware of how some of these small rural hospitals are aging, and they are really, they need an upgrade and an overhaul, especially when it comes to telemedicine, because let's all talk about that. Telemedicine, especially during COVID-19, has become critically important, hasn't it?
Well, if I could just jump in and talk about that. When you're looking at being able to deliver health care, when you're looking at people that work from home, when you're looking at, you know, commerce, education, all those things, being able to do that remotely is so critical. And we in the CARES Act put money in there to make sure that there would be reimbursements for telemedicine. But to do that, we need more access, more rural broadband those kind of things. And we're really looking into that. And I'm glad to see the president take this step because it's so important. When we talk about infrastructure, everybody thinks of roads and bridges and all the things you can see. We like to talk about the things that you don't see, which would be broadband internet access, the upgrades for our hospitals, so that care can get delivered cost effectively. And I think that's really going to be an important part of being able to make sure people get the care they need. And then if there is somebody that needs to have a doctor look at something or communicate with their healthcare provider, and they're in this high-risk category, they wouldn't have to go out into a hospital or into a healthcare setting where people might be being seen for a disease that spreads sort of like COVID-19 or the flu or something like that.
All right, so important. Dr. Gold, you want to comment on the telemedicine aspect?
I sure do, because, you'd never imagine a recovering heart surgeon saying that broadband coverage is one of the most important things in the delivery of health care, but it absolutely is. And we've learned through this COVID-19, but we've had some indications before for taking care of rural Americans that the ability to get quality broadband into their home, into their place of work, into their community is absolutely critical, but not just for patients and their families for routine types of matters, which has gone up by 200, 300-fold over the last 3 months across the United States, but actually for a lot of the rural healthcare providers who want to show somebody a scan or an x-ray or a microscope section and say, what do you think about this? And this way they can participate in tumor boards, they can participate in cardiac cath conferences, and they can get all the consultative help that they need, and yet the patients get to stay at home in their rural community and get the care that they need with the combination of their local healthcare professionals and experts across the country and around the world. So it's really a very critical thing, and I am really pleased to hear that the president made this announcement today.
Yes, it is awesome. I actually was able to sit in on a webinar this past Friday with Tom Vilsack, and he gave a great analogy. He said COVID-19 has basically ripped the Band-Aid off of the problems that already existed in rural America with rural health care. And I assume, Congressman Keller, you have probably seen this firsthand. I know you were able to go around and visit hospitals across your state. What did you see? What was that like?
Well, the visits we did, much of which occurred prior to COVID-19, we saw people trying to make sure that they could deliver the care effectively and get the job done. And I'd actually participated over the past few years prior to getting into Congress. I was in the General Assembly in Pennsylvania and participated in some telemedicine activities with our hospitals. And it's really amazing, and I think Dr. Gold hit it, that you can take a patient, and maybe even if they're going to a facility in one place, you can get an expert that might be a couple hundred miles away to be able to look at what the doctor that's providing the care, the healthcare provider providing the care right there, and help get a second opinion and guide the diagnosis. We are getting back out, having some more roundtables in central and northeastern Pennsylvania to understand, now that we've seen COVID-19, what other things do we need to be looking at? The Rural Help Act is one of the things we saw when we did our initial roundtables, and that's why we introduced it. And that's why we think it's so important to make sure that our rural hospitals have the resources they need to be able to provide the care. So looking very much forward to getting back out and seeing what work we can do to help our healthcare providers support the population in rural America.
And Congressman Keller, I know that we've already talked about the bill that you have co-written and co-sponsored, but let's talk more specifically. I know to your home state there, Pennsylvania, what will it actually do for the hospitals there and healthcare providers?
Well, what it will do is it will make sure that in the area I represent, and when you look at the hospitals, we have hospitals in about eight of the 15 counties I represent, and a lot of them are looking at making sure that they can continue to provide the care. We actually, unfortunately, in our one community, had a hospital that closed within the last year, and making sure that people have the care they need. And that's really what this is driven to, because if they aren't receiving the payment they need to help cover the costs of providing health care in rural America, the hospitals are going to be faced with not being able to stay open. And that's really what we're focused at doing here. And some of this had been done in the past for outpatient care. We're simply saying, hey, we provide care inpatient in these hospitals, and our hospitals need to make sure that they have the adequate resources. And it's not looking at costing any more money. It's looking at saying, if we're going to pay this much, maybe we're paying too much in an urban area, and some of that reimbursement needs to be looked at, and those rates need to be adjusted to make sure we can provide the care and cover the costs in rural America.
Now, so far, 2 leading healthcare groups are actually supporting this bill. What are you hearing from them?
Well, we're hearing that when they took a look at this, they're saying that it's taking us in the right direction, and really providing the equitable distribution of the resources that they need. So they've been actually very helpful in making sure that they can do that, because they want to deliver high quality, cost effective care to vulnerable populations. And this would very much help that, because they have some financial challenges, and these payments need to make sure that they're balanced, and we're being able to cover the cost for rural America. And when you look at what's happening, this is focusing on Medicare right now, because we do have an aging population in rural America. So start here. There's likely going to be more work to be done on this, but we wanted to, rather than just wait to get things done, we thought the more we started to step up and address these issues, as soon as we got the coalition together, it would benefit everybody. It would benefit the people who live in rural America. It would benefit the healthcare providers, and that's really why we introduced this about a month ago. And we're looking at we're continuing to gain support, and we're very optimistic that we can get something done with this, here this fall when we get back in session.
Well, I know we were actually just looking at a quote from the Rural Hospital Association, where they were supporting your bill for sure, the Rural Hospital Coalition, actually. It says, our 65 hospital members are proud to support H.R. 7534, the reviewing urban and rural adjustment to level hospital expenses and lopsided payments, otherwise known as the Rural Help Act. Well, the Rural Hospital Coalition letter reads that, as you know, delivering high-quality, cost-efficient care to vulnerable populations is a particular challenge for those in rural areas, where communities face unique barriers to health care coverage and access. This important legislation would shed light into the financial challenges facing rural hospitals and the payment mechanisms that drive continued imbalances. That's from the Rural Hospital Coalition. So you are already seeing some support there, and hopefully that bill will move forward. Now, Dr. Gold, you've also looked at this bill. What are your thoughts on it?
Well, I think it's a very important step forward to shine some sunlight into this question. I've had the opportunity, there are 63 critical access hospitals, at least last time I counted, in Nebraska, and I visited 60 of them over the last several years, and I've come to really understand how delicately balanced they are from a financial perspective, while they're trying very hard to deliver quality health care to their rural communities and keep those communities vibrant. They're a combination of inpatient and outpatient services, laboratory services, physical therapy, and rehabilitation. And many of them are built and sustained in rural communities where disease prevalence, there's just another recent very important study that showed that the prevalence of high blood pressure or hypertension, diabetes, heart disease, asthma, COPD are actually disproportionately higher in farming and ranching communities, small rural communities, than they are in the large urban cities. Now, of course, there are exceptions to that as a rule, but there's no shortage of these comorbidities, which translates into more need for inpatient and outpatient health care at an affordable level, and frankly, tragically, more mortality from COVID-19 when it does strike into these rural communities. So I think this is a really great idea to shed some light on this and to try to create equity if we can. That's what good governance is to identify these kinds of problems, get good data to make decisions, and then act on it.
And Congressman Keller, can you tell us the next steps for this bill?
Well, right now, again, we've been getting support in the House, and we've had co-sponsors. Also, reaching over into the Senate and seeing if who we can get to take up the charge there, so that then when we get something done and get to them, they're already through that. And also talking to the administration and let them know the importance of what we're doing to move this bill forward. So, it's a matter of right now getting it before the committees, working with my colleagues in the House, gaining support this month. Some of our visits to the hospitals, getting them to contact their members of Congress and work with leadership to get it to through committee into the House floor, and then also to make sure that the Senate takes it up and it gets onto the president's desk. We actually were able to do that with an amendment to some bills to the Older Americans Act last year when it dealt with scans for older Americans that had falls, because there was a lot of times they had a head trauma, and some of that was going undetected. So we were able to get that done as an amendment to another bill. So we're looking at every option we have to make sure that we can get this done and have this before everybody, and make sure that we get this imbalance figured out so that we can continue to have quality health care in rural America for those people that deserve it so much.
Anything else you think Congress could be doing at this time to support rural hospitals and rural health care as a whole?
Well, I think we need to, we did a lot in the CARES Act. Is there more to be done? Absolutely. Because as Dr. Gold had mentioned, while we were trying to make sure there were resources available, should there be, a lot of COVID-19 need, there were some procedures, and I won't call them elective because, as we discussed earlier, I don't think people are looking at getting their heart checked or their stress test or those things as elective procedures, but certainly necessary. But so there's hospitals that have not done those kind of procedures, and that has really hurt what their bottom line, because that's sort of what they're having, and then they're not seeing patients because people aren't going in for these things, and some people aren't going to the emergency room or other urgent care places. And they're seeing some impacts from that. So I think we really need to take a look at how that effect is and what we should be addressing as we go forward. And quite frankly, now that things are opening up a little bit and we're able to have our roundtables, that's what I'm looking forward to be able to do this upcoming month of August, when we're in the district work period, to discuss with our hospitals in rural America what we should be looking at and how we address those issues, because I'm sure there's going to be, it's affected probably different parts of our Commonwealth differently, depending upon the amount of treatment they gave for COVID-19, but certainly hospitals in need of help. And that's really what we want to make sure, because the COVID-19, in addition to how tragic it's been for new cases and for people that have died from it and needed care, the other side of it is there's people that have gone without care for other diseases or ailments. And we're going to need to make sure that the healthcare system is ready and equipped to handle that when we start to see that care come back. And we've seen that in rural Pennsylvania here a little bit. Some of the hospitals have gotten back to doing more of those screenings, of those other procedures that that need to be done, but are not COVID-19 related, and something that I would say is maybe an inpatient or as acute as dealing with the COVID-19.
Right, may not be life-threatening, but it certainly affects quality of life. Dr. Gold, would you like to add anything to that?
I would, Tammy. One of the things that I hear all the time when I visit our rural hospitals is I always say, what are the top 3 things that the university could do to help you? And it always is the same thing. It's, Dr. Gold, it's workforce, workforce, and workforce. And by the way, Jeff, if you're not listening, we need more workforce. And this is doctors, nurses, pharmacists, therapists. It's all of that. So the solution to this is to create rural training tracks, particularly for doctors and nurses and pharmacists and others, and to be sure that there's a mechanism by which individuals are identified. You know, the single best predictor of getting somebody to want to work in a rural community is if they grew up in that community, they went to med school or nursing school or pharmacy school, and they turn around and say, I want to work in this community. But if they can't get a residency or a fellowship or a training opportunity, they're going to get recruited off into some big city who's probably going to pay them a little bit more and offer them a different kind of quality of life. And so anything that we can do to create workforce incentives is going to help support rural America's healthcare system, which is going to help support the quality of life in rural America.
Excellent point. A lot of people do want to go back home, but you got to be able to make a living. We're going to take a quick break, but our phone lines are open. Would love to hear from you and have you on the show. 877-731-6733. More Rural Health Matters with the University of Nebraska Medical Center after this.
I'm Rob Sharkey. They call me the Shark Farmer. You know, I would have thought the sequel to Top Gun would have been a little bit better than this.
The highlights of those keeping America fed.
This is a part where I should probably stop talking and we should listen.
Plus, meet our special guest.
I'm actually approaching farmers all over, telling them, hey, I want to jump in the tractor with you. I want to learn more about what you're doing. And they look at me like I'm not.
Shark Farmer, airing Tuesday nights at 9:30 p.m. Eastern on RFD TV.
Introducing the Dish Refer a Friend program, the easiest way to share better TV. Because watching TV with Dish is just better. In fact, Dish makes all the best things better. Like the best binge-a-thons, the best multitasking, the best way to spend a night in, and more. Oh, and we have better rewards, too. When you refer a friend to Dish, you'll both earn points you can redeem for things like $100 in bill credits, free movie rentals, a Polk Audio smart surround system, and more. Need more reasons to refer friends? Dish is ranked #1 in customer satisfaction by J.D. Power and our customers. So go ahead and refer. You can be confident they'll thank you for it. All you have to do is text RAF to 34741 or visit mydish.com/refer. Give your friends and family a better TV experience, and you'll both be rewarded for it. Start referring today. Dish. Tuned into you.
August is heating up on the Cowboy Channel with a Pro Rodeo Tour doubleheader from the Heartland on Pro Rodeo Live. The Lawton Ranger Rodeo from Lawton, Oklahoma, and the Boot Heel Rodeo from Sikeston, Missouri. Pro Rodeo regular season is down to its final 60 days, and the battle to qualify for the NFR is red hot. Every ride, every run, every dollar has an impact. It's the best from Lawton and Sikeston on Pro Rodeo Live at 8 Eastern and streaming live on the PRCA on the Cowboy Channel Plus app.
Welcome back to Rural Health Matters. I'm Tammy Orinder. Joining us once again, University of Nebraska Medical Center Chancellor Dr. Jeffrey Gold and U.S. Congressman Fred Keller of Pennsylvania. We appreciate you guys taking time today. Very important subject and very timely right now. Let's talk about kids getting ready to go back to school. I have heard so many different combinations of virtual school, online, in person. What are they going to do? Congressman Keller, what's your take on all of this? What are you seeing in Pennsylvania as far as kids going back to school?
Well, we're seeing a lot of our local school districts start to come out with plans that include, I'll say, a hybrid of some in-class learning, maybe starting a little later in the day, in school a couple days, then online a few days. I think we can do it. We can get it open safely if we follow the Department of Health and CDC guidelines. Saw a lot of good plans. One thing I'd like to just sort of say when it comes to schooling is there's a children's museum in Lewisburg, Pennsylvania, and I know that the paper had mentioned that they reopened this week, and mentioned some of what they had done. So I think when we look at what's happening, I know that the school districts are going to be able to do it. We did provide a lot of resources through the CARES Act for school districts. Pennsylvania got $523 million for this. We have 500 school districts. So, if you do quick math for the public sector, the public side of it, there's money there to help support the schools and some additional costs they would have to make sure that the schools can reopen safely. But I know we have a lot of talented, thoughtful people that work very hard. in our school system, whether it's the public school system or some of our private schools, that will be able to figure out how to do it safely, follow that guidance, and make sure that our kids can get back to school. The American Academy of Pediatrics says that kids should get back to school. It's good for them. It's healthy. They need to be able to do that, and I think we can figure out how to do it safely. It's just a matter of seeing what fits. And what works well in rural Pennsylvania might look a little different when you get into the places like Philadelphia County or Allegheny County. So I think we need to keep that in mind too, that it's not going to be a one-size-fits-all thing depending upon where you are in the country. So I think we can do it. The busing, I saw a picture of the bus there. The busing may look different. Things will be a little different, but again, I think we can do it. We've been very resourceful in the past, and our kids, they will do what we need them to do, and I think we can do it and have kids back in school learning this fall.
Dr. Gold, your thoughts?
Sure. Well, I mean, to start off with, every parent and most of our students and certainly our communities want to send our kids back to school. They want to send our kids back to school because they don't want to delay or slow down their educational journey. But in many instances, this is about food security, this is about health care, this is about socialization of younger children. So it's really critical to get our kids back to school in an effective and safe way. But there are a number of things that I think have become increasingly obvious. One is that the K-5 generation is different than middle school and high school. And of course, we're not talking about higher ed now, we're just talking about the K-12 system in general. And the K-5 students, first of all, they don't do well with remote education as well as the middle school and high schoolers do. Secondly, they're much more in need of socialization at that age. And thirdly, and probably very importantly, is there's now good scientific evidence, at least thus far, and it could change tomorrow, but there is scientific evidence that these little kiddies do not transmit the virus with the same degree of transmissibility as children over 10 years of age do. And so if they're transmitting the virus less and they need to be in school more, there needs to be a plan, if at all possible, to get them back as the first part of the back-to-school move. Now, we've also learned, as the Congressman said, is that there are a lot of differences between rural and urban communities, and even among and between the urban communities and among and between the rural communities. And what I mean by that, it's going to be very different to bring kids back to school that have virus rates that are in the 100 per million per day category, the 200 cases per million per day category, or to put it in different terms, with positive test ratios of 24, 25, 28%, as opposed to under 5% or under 1%. And so there need to be two different things that occur. One is you need to open schools safely in communities that have reasonable control of the transmission of the virus. And then you need to put appropriate precautions in place, whether they're hand sanitizers, face masks, making the class size smaller. You know, we've worked very closely with many, many school districts here in our part of the Midwest. And there are no two that are alike. Some are going to every other day. Some are going to 3 days a week. Some are going to mornings versus afternoons. Some are going to K-5 only. So they're all different, but they're all predicated on creating a safe learning environment. And I can tell you that the school districts around here, and I'm sure the same thing's true in Pennsylvania, have said we all want our children back in school, but we all want them to be safe, and we don't want them bringing virus home to get our parents and grandparents, vulnerable neighbors and friends sick. So it's a very, very delicate balance. And it's going to play out because in the next couple of weeks, our kids, in some communities here in the Midwest are already heading back to school this week and next week. And so we're going to be seeing more and more of that. And we're going to have to be thoughtful and flexible and be willing to change if things change in the community. So pretty complex question.
It is, and like you said, everybody is dealing with it differently. I think we're going to see a lot of kids wear those masks, have that hand sanitizer, and again, it becomes part of your norm and a part of your routine, and I think the kids can adapt to that. Sometimes I think parents have a little harder time adapting to those new terms and getting ready every day and doing everything, but I think we're going to see that in our classrooms as well. Dr. Gold, have you seen some unique strategies that have proven successful to help prevent the spread among rural populations?
You know, Tammy, we've talked about a lot of them, and I think rural populations are already spread out a good deal, particularly our farming and ranching communities. So they start off with the fortunate benefit of not being compacted. And indeed, a lot of what happens in terms of this disease spread really relates to what happens when they go shopping, when they go into town for supplies, when they gather on weekends, if they go to church or other social gatherings and that sort of thing. What I've seen in the rural communities that we serve, which is really very prominent, is there was initially a considerable resistance to wearing a mask just because it was uncomfortable and people weren't used to it. But with the widespread of the use of masking, I've seen the rural and urban and the rural and farming and ranching communities take hold of that. And they're very used to protecting themselves from pollen and dust and grain particles, and now they're willing to protect themselves from COVID-19. So that plus the access to rural telemedicine healthcare, I think, is part of the secret sauce that's going to keep our rural communities healthy and get us through a point that we have safe and effective vaccines, which, by the way, I'm hoping are out before Thanksgiving.
Yes, hoping we can get vaccine out there soon. I tell you what, we've had a couple of people on the phones we've not been able to get to, but I think Richard from California, you still with us? What question do you have?
Yes, I live in a rural section here in Northern California, and most of my neighbors believe that this is a hoax and not to be taken seriously. And I'm just wondering how I can get through to these people. And when I ask them something like, would you mind if your surgeon does not wear a mask, they get terribly angry. And I'm just trying to find out what it is that I can inform these people with, because all the information they give me are things that can only be found on social media, which of course is just filled with misinformation. How can I get these people to convince them to follow the science to protect me and themselves from their misinformation?
Dr. Gold?
Oh, Richard, that could be one of the best questions of the night. And unfortunately, your colleagues and friends are not the only people asking that exact type of question. My answer to them is they do need to have reliable sources of information, and social media is full of all kinds of misinformation. But you look at the numbers of people that are hospitalized. We just talked not too long ago about more than 4.5 million American infections. We talked about over 155,000 American deaths in less than 4 months. I mean, you think about it, the entire loss to the American workforce and to the American population during the Second World War was just over 425,000 individuals over the many years of that combat that occurred in Europe and across the globe. And now we're talking about 155,000 confirmed cases, not to mention what is probably at least twice that many not confirmed cases, with numbers that, if not controlled, could easily double by the Christmas holidays, And so my best advice to you is be a good steward. Wear your mask. Provide people with access to quality information. It doesn't make any difference, frankly, which media channel you choose. It doesn't make any difference whether you come from the red or the blue side of the aisle. This is a very, very real issue. And I can tell you, as a practicing surgeon for 25 years, the day never came for myself or any members of my team, should I wear a mask, should I not wear a mask, should I scrub my hands, should I not scrub my hands? Of course we did, because we wanted to take the very best care of our patients. And this is a time for America to reach the same set of conclusions. We want to take the very best care of the communities we care and love.
Right, taking that responsibility. We have just a couple of minutes left. Final thoughts? Dr. Gold, you want to go first?
Well, I think I've said my piece. We all own this, and we're in this together, and we've got to get through to a point of availability of safe and effective vaccine. And we'll unpack that a little bit more, I'm sure, next week. But a very, very important time. America is on a critical journey, and we've got to be sure that we do the very best we can.
Right. Congressman Keller? Final thoughts?
Thank you for having me this evening and the ability to communicate to rural America on such important issues. When we're looking at COVID-19, I know Americans are the most resourceful. We care about our communities. We'll get through this, but it's a matter of us doing it together. It's a matter of us understanding, what it is we're fighting and how we best succeed. And as Dr. Gold mentioned, we hope to soon have a vaccine. But up until that point, we need to make sure that we're all taking the precautions, doing things safely. I think we can do that. We can get our kids in school. But I do know, as Americans, we always rise to the challenge to help one another and get through this. So I look forward to being able to get out to more of the rural health care providers, seeing what we can do as Congress to make sure that the rural health care providers have the resources they need, that America's families have the resources they need, and we all get through this together.
All right. Well, Congressman Keller, Dr. Gold, we appreciate both of you, all of your efforts and the initiative that you take to help keeping rural America safe. I love your mask. I've got mine right here too. Try and wear it every time I am around people and walk outside. Thank you so much for being with us, and we appreciate you.